In the heart of Yorkshire, our health service is hard at work.
Emergency department, Barnsley Hospital.
It's relaxed, mate.
A dedicated team
Stop making me laugh.
working 24 hours a day, 7 days a week.
Look forward for me.
Trainee coming through.
Ready for anything
I think I've just about got it cracked, this job.
and everything.
Big chair. Any pain at all? No.
Still alive. Still alive.
Well, you're stuck with me now.
Wow. I'm down, boss.
Lucky you, Wes.
Facing life
We're back from the moon.
and death,
Go on, keep going, sweetheart.
trauma
Fabulous.
and tears.
I know.
Supporting each other through the toughest shifts.
God help me today.
I'm not coming on. Can this not feel warming?
Is this covered? Is it like this big or is it like this big?
It's big. Buckingham Palace one day, Barnsley Hospital next.
Oh, I love it.
It's like feet.
This is Barnsley Casualty 24/7.
God bless the NHS.
On shift tonight, charge nurse Johnny,
You're very chatty, aren't you?
Yeah.
Yeah. Do you like school? No, you don't like school.
consultant Dr. Laura Buxton,
Do you suffer with your heart?
Yeah.
and advanced clinic practitioner Chantal.
Sat in wrong place today.
So get ready to share a shift
I need to get some people out of resource. This is stupid.
with the team at Barnsley Casualty.
Barnsley.
5, 6, 7, 8, 9.
This morning, Sister Jane has lost count of the number of times the red phone has already rung.
Hello. Emergency department, Barnsley Hospital.
And it means she's managing a resus bursting at the seams with the most poorly patients.
Is he going to scan? He's been. Anything on it that you could see? Nobody wants that to happen. Nobody.
When resus is full, the knock-on effect for the whole department is huge.
You're then limited with how many nurses you've got to look after the other 80, 90 patients in the department. You want to get your resource clear, you want to get majors clear because there's ambulances on the back corridor, and you've still got other patients coming in who need treatment as well. What's he got now?
We've got a stroke on end.
Yeah.
This one's waiting for a ward.
Okay.
And this poor man is just waiting to book to ward as well.
You're just trying to juggle everything.
And now, yet another emergency is on the way.
Is it a medical trauma? It's a medical. And out of where? His mouth. He's got chest pain.
Paramedics are bringing in a 75-year-old former miner who's struggling to breathe. Terry has an incurable chronic lung condition known as COPD. It means that for 15 years, he's had constant problems with his breathing.
Sorry, are you in any pain anywhere? No, just only breathing at the moment. Yeah.
Dr. Laura Buxton has been called to resus.
I see countless patients with the same presentation. Back pain or chest pain or headache, but they're all different.
Hello, sir. I'm Laura. I'm one of the doctors. Nice to meet you.
It's about being able to find the nuance that is why that person came to see the emergency department team on that particular day with that particular problem.
Just have a little listen. That's it. Keep going with those breaths.
But what Dr. Buxton discovers isn't consistent with usual COPD symptoms.
His chest sounds quite wet. Actually, not that wheezy. Yeah.
If it's not just his lung condition that's causing Terry's breathing problems, she needs to urgently work out what is. Back in the hub,
Sat in wrong place today.
clinical practitioner Chantal is taking another emergency call from paramedics.
You're looking inside.
yourself?
They're bringing in an 84-year-old who's had a very nasty fall.
Pop him through a hub and then we'll assess him. Hello, is it Anthony?
Something I have learnt in ED is knowing how patients fall.
So what have you done then? Tell me what you've done.
I've been top loose.
Yeah?
Caught, step, and then I went over in the rail. I hit it and not.
You hit it about there?
Yeah. I hear something go, and then I just fell off clouds and all my shopping was on top of it, yeah.
There is an element of detective work.
When I try to move this, it is, you know.
Any pain in your pelvis?
No.
It could be that they've just tripped and then got an injury or a break.
Well done.
Heart.
And can you move your elbow or not?
No.
And then can you put your fingers like this? Push me out.
Clinical practitioner Chantel suspects a broken shoulder.
Right, let me have a chat to them orthopaedic doctors, okay? And I'll come in and tell you the plan.
So Anthony is taken to radiology for an X-ray to find out exactly what's happened. Back in Resus, Dr. Buxton is urgently trying to find out why Terry is struggling to breathe.
Have you had any pain in your chest today? No, not at all. Do you suffer with your heart? Yes. I don't think this is all an acute COPD. My feeling was that there's possibly an element of pulmonary edema going on. It looks like a candidate for flash pulmonary edema.
Yes.
Dr. Buxton believes the wet fluid she can hear is caused by a pulmonary edema, a potentially serious heart condition.
He has a background of breathing difficulties, but he's been really struggling additionally today. When patients get ill for another reason, it can make their COPD worse.
If Terry's heart isn't doing its job, the team needs to get more oxygen flowing around his system. Or he could go into complete organ failure. In Barnsley Casualty today, the emergency red phone is ringing non-stop.
I need to get some people out of resource. This is stupid.
And a full resus is putting extra pressure on the whole department.
Just, do what you can.
But in resus, 75-year-old former miner Terry has an incurable lung condition and is struggling to breathe.
Try and keep your head forward. No, it's on it. Go on. Put your head forward. That's the one. Like that.
In Barnsley, 1 in 8 emergency admissions are caused by COPD. But Dr. Buxton suspects it's a new heart issue causing today's problem. He's not well enough to be wheeled up to X-ray. So, it comes to him.
Hold your breath. X-rays. That's lovely.
It's usually caused when the heart isn't pumping effectively enough and you get this backup pressure of fluid in the lungs.
Sitting upright is not helping Terry. So advanced clinical practitioner Cheryl suggests they try a different.
You're going to be the boss of this move. We'll only go when you're ready. Right, Terry, nice and steady. When you're ready, bring your legs round. Just do it in stage. You don't have to do it all now. Just wait. Alright. A minute. Okay.
It might help make him more comfortable.
Right, just wait there. Just sit there and wait.
But his breathing seems to have got worse.
You don't have to rush. You're not going to have to move after this now, I promise you. Just have a minute there. If you're breathing at the minute there as well, I think. You know, Terry, out your mouth.
The way he's feeling is not good, and it makes you panic as well because you feel like you can't move the air, you can't breathe, of course, and it's a quite nasty feeling for him.
I'm going to swing your legs 1, 2, 3.
Lovely.
Like that.
Clinical practitioner Cheryl has the results of Terry's X-ray and blood tests.
It's not telling me an awful lot, except that it looks like he's got quite a lot of fluid on board. But looking at the patient as opposed to that, he's struggling a bit. So I'm going to go and listen to his chest.
Sarah, are you okay? If you were, if I relax again.
Every time the fluid gets cleared away,
Better?
it comes back even worse. Nothing seems to be working, and Terry's struggling to cope.
He's had everything I can give him, really, hasn't he? It's getting worse.
There's been an accident at school. Mum Stacey and Nan Ruth have brought in their lively 5-year-old Sadie.
I'm surprised she hasn't been here before now, to be honest with you. She's very clumsy, aren't you?
Nurse Johnny is triaging in paediatrics today.
What's your name? Sadie. And what have you done, Sadie? Have you hurt your arm? Have you hurt your arm? Can you tell me? Yeah.
I got a phone call from school. Basically, she's landed funny on her wrist.
So this arm's fine, I take it? Yeah. Did you bang your head? No, is it just that one? So, it is quite swollen, isn't it? Can you wiggle your fingers for me? Good girl. So it is quite swollen, it does look a bit deformed. So, is she allergic to anything at all?
Spiders.
You're allergic to spiders? Right, well, we'll make sure we get no spiders then. So, but we need to go for an x-ray, okay? And then we'll take a picture. Who's going to do it? I'm going to do it. I'm going to get a big camera, and you need to say cheese, and then go ch-ch, and take a picture of you. Is that okay? Superstar. You're very chatty, aren't you? Do you like talking? Yeah. Do you like school? No, you don't like school. No. What do you like playing with at home?
I like playing with my trampoline.
You like going on the trampoline? Yeah. And do you go really high?
Yeah.
And can you do lots of flips? Yeah. So you're going to be a regular then in A&E, I take it then? Yeah. Right. Let me go and sort that x-ray out. Okay. Right.
During shifts where the red phone is constantly ringing,
Dear me.
the sister in charge is forever playing catch-up.
Waiting room staff board. What day is it today? Tuesday.
And today, Sister Jane has asked clinical practitioner Chantal to take charge of the emergency phone.
When the red phone's ringing quite a lot, stress levels do increase.
Hello, Master Casualty.
When I went new to A&E, it was quite a distinct, loud call. It used to make me feel a bit anxious and nervous to answer the phone.
Fancy A&E.
He's getting lots of practice today.
Is it red?
It is. It's not royal. It's not blue.
In Cubicle 5, her latest emergency needs to let his son know he's in hospital.
It's me, love. Agony. No, it's my left shoulder. I tripped up on both.
And he's been for an x-ray on a suspected broken shoulder.
But somebody will have to look after your mum. I can't now.
The primary carer for his poorly wife, he's worrying about how they're going to cope.
What? I feel awful from me being so stupid. I should have got a taxi home. I thought, no, I'll save some money and, well, it's happened and that's it. I'll have to fight it, get over it. And there's people will suffer me, mate. A lot of people will suffer me.
Shoulder here.
Clinical practitioner Chantal has the results of Anthony's x-ray.
So it looks like he's fractured the top of his humeral bone, which is where the head attaches to the humerus. It's not just one nice break, there's multiple fragments of fracture. But I suspect he may need surgery.
Time to break the news.
Hello, Mallow, let me just move this before I break something. Then there'll be two of us, won't we? for?
My ribs.
Your ribs? How did you do that?
I've got crushed down ground for fifth, and it smashed my ribs.
How did you get crushed?
The machine fell on me.
A machine fell on you?
Obviously, Barnsley is a mining community, and the surrounding towns or villages are all mining villages, so we do see a lot of miners.
So what did they do? Did they have to get you up to ground level and then got you to an hospital? And which hospital did you come to? Did you come here? Oh, you're lucky then, aren't you? And instead, you've now fractured your arm?
Don't really need my arm. I'm like $6 million.
Your first story were better.
Yeah.
Your second story is getting on a bus with some shopping.
Oh, stop making me laugh.
As Anthony is 84, clinical practitioner Chantel needs to know how he'll cope once he leaves A&E.
Even though I'm treating the patient and the patient has a problem, I always think about them going home. Who's at home? How will they mobilise? Are they safe?
Who do you live with at home?
My wife.
Your wife. Does your wife know you're here?
Yeah.
Good stuff. Okay.
Outside.
All right. And is she safe at home at the minute?
Yeah, with my son.
She's with your son?
Yeah.
And are you the main carer for your wife?
Yeah.
Normally, patients who need orthopaedic surgery are sent home until the date of their operation. But now clinical practitioner Chantel is to see if she can come up with a different plan.
Because it's a quite painful fracture and he's 84-year-old. And he is the sole carer for his wife. He might not be able to manage at home and look after his wife, so I need to find out if he can manage at home first and then go from there. Okay.
Working on the other side of the hub is a team of emergency nurse practitioners. On busy days like today, they can be the only thing keeping Casualty from grinding to a complete halt.
We do about a third of what attendances we get here, and we do everything for them, whereas the rest of the department, the patient gets triaged by somebody else, then they'll get seen by our doctor, and then your nurse will go in and do a treatment, but we do the whole thing. We just crack on.
Waiting to see Nurse Becky is 26-year-old Elliot, who was doing some building work on a house extension.
I was grinding away at some brickwork, literally a second straight in the face.
But he's hoping his day isn't going to get any worse.
I don't want a massive scar on my face. I've been non-stop looking at it, dreading what's going to be the outcome, really.
Elliot, please. Hi, lovey, come through.
Hiya.
Come and take a seat for me. So, my name's Becky. So, what you been doing and when?
Today at work, grinders hit me in the face.
Okay. So, it's sort of like hit, probably I'm getting a hard bit and then it's caught back. So, you've been really lucky, haven't you? To be fair. Let me just gear up to have a quick look at you.
Will it need stitches?
I'm going to have a look at it. We only stitch when we have to stitch. So, if we can get away not stitching,
That'd be amazing.
we will. But obviously, it's on your face.
Yeah.
So, we've always got to, to prepare people that you may have a scar. It's not affected your vision, anything like that. No other injuries. Right, just slip your mask off for me.
Would you say it's deep? Deep enough?
It's gaping a little bit and a bit jagged. I think potentially, we've got a bit of swelling, but I think potentially it will glue.
Oh, that would be marvellous.
No stitches required. A bad day just got a bit better for the builder.
You've been lucky.
I've been very lucky.
Could have been a lot worse. You could have gone through your cheekbone. Through your eye. Let me go out. Had anything glued before?
Other than pieces of paper now.
Right. You probably will have a little scar, but it'll be nothing major.
Can cope with little scars.
So I'll put you plenty on, so hopefully it shouldn't come open, but I want you to go home and rest.
Brilliant, thank you very much.
Any questions at all?
No, I think you've covered about everything.
Okay, you might have a bit of a black eye there. Got a bit of a bruise coming.
Hit me on eye as well.
Yeah, so you've been lucky that it didn't get you there, really. And that's it, you're good to go.
Nice one, thank you very much.
Oh, you're very welcome.
Right, see you later, thank you very much.
It's been extremely lucky. I've seen injuries before that have been done by power tools where people have gone through the whole cheekbone or even through their eye. So, a nasty injury, but it could have been a lot worse.
In and out in less than half an hour. That's one less patient for Sister Jane to worry about. Back in resus, Dr. Buxton and clinical practitioner Cheryl are getting increasingly concerned about Terry.
He says to me, I feel like I'm just not getting better. He's panicking a little bit as well.
They're worried Terry has left it too late to get treatment. Clinical practitioner Cheryl thinks it's time to call his family.
Tracy, your daughter. She's your daughter, isn't she? Is she your next of kin?
Oh, what do you say?
For the older generation of patients who I would regard as very stoical, they're extremely stubborn, but also a very capable generation of people who are used to having to fend for themselves.
Yeah, so at the moment he's in A&E, he's in resource, so we're just trying to help him, and I think he's starting to take his toll.
It's always a red flag to me to see a patient who is older and has been coping with their symptoms for that bit longer.
He's having treatment, he's on oxygen at the moment, so if you do come through, you would be able to come into resource unit where you need to see him. Take care, bye-bye.
With Terry's lungs constantly filling up, it's like he's drowning.
It's increasingly filling his chest with fluid, so he's struggling from that point of view.
They urgently need to get more oxygen into his body.
Does sound worse to me.
Barnsley Casualty this afternoon, the red phone hasn't stopped ringing, which means resus is full. Sister Jane has called an urgent meeting.
My resus is full at the minute, apart from one empty bed. I can't step anybody down.
So I've asked for him to go first to give us resus.
Okay, that's fine. It's stressful for anybody who has a department full of 86, 87 poorly people or more, still having patients coming through the doors.
So many emergency admissions increases the pressure on every aspect of the department.
They're aware that Reese is busy, so he's going to be the first on the list.
Okay, alright, thank you.
But the red phone rings again.
I've only got one bed in resource at the minute. Where's it going?
Paramedics are bringing in a 29-year-old who's been burnt in a chip pan accident.
This is Sean.
Yeah?
Sean's 29. Been cooking his dinner on the chip pan. It's cold up his face. But he would have constantly wetted his face with cold water.
Yeah.
So he's had cold water on his face since the incident.
Consultant Dr. James Griffiths needs to decide if Sean's injuries require treatment in resus.
So you were just cooking some chips for lunch, were you, and all of a sudden...
Feels like all this and then right hand are same sort of feeling, like a throbbing pain, because it also caught me right hand.
And how bad is your pain at the moment?
8 and
But it's not Sean's external pain that's concerning Dr. Griffiths.
What we worry about with facial burns is any potential airway or inhalational injury that can cause problems later on.
Any internal injuries would require urgent treatment in resus. But in resus, there is some good news at last.
Darren, so the physiotherapist is going to come and help you get some of that nasty stuff off your chest. Hey, this is lovely. Okay.
Terry's responded well to an oxygen increase. It's now safe for clinical practitioner Cheryl to start the next phase of treatment.
I've got chest to loosen all the secretions and hopefully breathe better. It's really, really effective in most patients, so it should really help him out, I think.
Terry won't be going home today. Instead, physiotherapist Katie will be looking after him on the ward.
Hello, Terence. How are we doing? You're weak. My name's Katie. I'm one of the physios. I'm not going to hurt you, I promise you. Let me turn that nebulizer off and I might be able to hear you a bit better.
Now Terry's breathing is improving.
Can I just have a look in your mouth?
It's putting less pressure on his heart.
That'll make you feel a bit better.
All part of the complications of living with COPD.
Because
because of the nature of what area we're in Barnsley and the mining community and things like that, we get lots of people with it because they had exposure to pollution and fumes and things like that. So it's quite common. Quite a lot of people, even if they don't struggle with it, they've got it as a past medical history. There you go. Just be careful. It's quite cool. It'll be quite nice. So I'm going to turn your oxygen down a bit. Is that a bit better? Gorgeous.
And finally,
so is it alright if I put that on?
the immediate danger is over.
Alright, your breathing does seem a lot better.
Terry can now be left in Katie's care.
My colleague's going to look after you now, and I'll be thinking about you. Alright, my darling. I'll check up on you, see how you got on. Alright, be good.
Terry spent a week on the specialist respiratory ward. He's now back home, being looked after by his daughter. In paediatrics,
Stop doing that with your eye, please.
5-year-old Sadie is back from X-ray. And her results?
Here are these 2 bones, here are these 2 bones at your forearm here. So she's broken this one, it's broken here.
Hi.
Managed to operate, doctors. We've definitely broken the 2 bones in the forearm here.
Yep.
We're just having a bit of discussion about what we need to do here. Sadie, when did you last have something to eat or drink?
That doesn't sound great. You're not thinking about an operation, are you?
The discussion is we need to put a cast on it. The question is whether it would be safe to give her a little bit of sedation and put it in a slightly better position now, or to leave it in the cast is essentially the question.
Right.
So I'm just kind of liaising with my boss in here.
Identifying the problem was simple enough, but with so many emergency patients in the department, deciding how to treat Sadie is much more complicated.
We're just working out whether we had the ability to manipulate it in the emergency department rather than doing it later down the line in theatres, but we don't have the space and resource to do it.
While they wait for an orthopaedic appointment to be confirmed, the team in A&E will temporarily patch her up.
So the plan with Sadie now, we're going to put a temporary pus on, and I think she's going to come back tomorrow morning. She'll go to theatre, and they'll do the manipulation there under anaesthetic. So unfortunately, this is only white. When you come back, you can pick your colours. Okay, you put your hand in there. Oh, well done. Then I'll bend it. Superstar.
While Nurse Johnny applies the cast.
That's it, and let's just move around just a touch.
It's just elbow, sweetheart.
That's it, superstar.
Well done.
He needs Nurse Molly to help distract Sadie.
Do you like stickers? No.
What about a certificate? I'm pretty sure I've got some snazzy certificates with an ambulance on.
Sorry, chicken. It's just set in now, and then we're done. Okay?
We'll go home very soon, I promise. Yeah.
Right. You stay there for 5 minutes, okay? I'll take you back down.
Cast on.
Certificates so that you've been really brave. I've got your ambulance was on. Is that alright? Are we happy with that?
Sadie gets prepped for a second X-ray before she's allowed to head home.
Leave it alone. Are you going to say cheese? Show me your teeth then. Is that what you're going to do? Perfect.
But there's still time for a kind word from her big sis. Sadie came back for a follow-up with orthopaedics, but is now back at school, cast-free.
What do you say?
See you later.
Thank you very much. Come on.
On days like this, challenging part of Sister Jane's role.
Patient safety means that the patient is safe in every single way. So they're safe from harm, they're fed and watered, the robs have been done regularly, that they've had the treatments that they need to have if they've got infections.
But staff welfare is equally important.
Katie, do you want to go for your brain now? Mimi's back. Don't be ignoring me, Katie.
And on shifts this busy, finding a moment for her team to take a dinner break can be tricky.
Are you alright round here?
Yeah.
Both of you?
Yeah.
Do you just want to take each other off for your break?
Sorry, I love it, Chantal, at ACPs in A&E.
In the hub, clinical practitioner Chantel is trying to balance what's best for her patient Anthony with his caring duties at home.
I'm going to go urgent care therapy see him, if they are still around, because he's the main carer for his wife with Alzheimer's.
Knowing Tony had a wife at home with Alzheimer's that's newly diagnosed and he cares for her, that brings a lot of anxiety.
My son will have to start with a fine stopping in hospital, do you know what I mean? They can't send me home like this. I mean, you've got to do something. It's painful. Oh.
But there's some bad news from orthopaedics.
Alright, fine. No.
Today's been busy for them too, and there's no space for him to stay overnight on the ward.
The plan is to give him some painkillers. Let's get a sling on him, let's see how he is moving around, and we'll see if he's okay to go home and have a chat with him what he wants to do. Worst case scenario, we can't manage, then we'll have to come back into hospital. So, the orthopaedic team, they've had a look at the fracture on the screen, and they're happy that we can send you home in a sling with some good pain relief. It is 7 o'clock now, and the physios and the occupational therapists have gone home, and it would have been very ideal for them to have a look at you to see if you can manage at home with simple tasks, because you are the main care of your wife. Okay.
Yeah, that's trouble, you see.
Yeah, and I don't want to send you home if it's too painful.
I don't want to go home like this.
No.
I've got to handle. No.
So what do you think's best?
I'm better off something else for a few athletes, best of luck.
I think so as well.
Yeah.
Clinical practitioner Chantel will have to find a bed somewhere in the hospital,
So we know
but that's only half the problem.
My worry is now about your wife. So if you're in hospital...
My son, he might do. He try to get some time off work. Right, that's it. Paul.
Is it Paul?
He calls his son to make sure.
He wanted me to speak to you just for me to update you, so... It is quite a painful fracture, and I'd be worried that he'd manage at home, especially with your mum.
If it were my partner or my mum or dad or grandparent, I think I'd have them same concerns, so I can empathise with you, Paul.
Bye. Okay.
You'll look after him, man, love. I'll let you know when it happens, alright?
Hello!
Anthony is prepped to head up to the clinical decisions unit for the night.
Stevie, let's have a cuddle. You in?
Yeah.
Ha! Oh, you doing it?
You were great fun, Tony.
Did you get down?
Yeah.
Well, don't tell them women wolf whistling that you do it. Yeah?
In the end, Anthony didn't need an operation, but he did spend 12 nights in hospital. He's now back home recovering with his wife.
Oh, he's lovely. Oh, he seems more chirpier than I would be if I had got that fracture. He seems like he's made of tough stuff.
Over in Miners, off-duty nurse Lisa has brought in an accident-prone family friend, Brad.
I've got so many scars on my body.
It's your own fault. You're a liability.
They're waiting to see emergency nurse practitioner Joe.
Known you, what, since you were about 5?
Yeah. I've been in some predicaments.
Absolutely.
I've dropped my collarbone, my wrist, all my knuckles, my fingers, my toes.
I know you've got attention deficit and all that, but...
I'll admit, I have.
I think that's probably why you keep getting you sending off.
It is.
Probably, you know. Tell me what happened then.
I got bored at work.
You got bored?
Yeah. Did a backflip.
Oh, what job do you do? Is it circus entertainer?
Entertainer, roofer. Oh, really?
Oh gosh, don't be doing backflips off at roof.
He's been warned. He's already been warned, trust me. He's actually got a video on his phone, Joe, if you want to see it.
Oh, go on, everywhere.
Would you like to see it?
Yeah. So his lifetime he's had blood knocks, scrapes, bumps,
That's
whatever.
it. That's me.
And he,
oh gosh.
Oh, good. And he never whinges, he never moans, he just brushes himself off and carries on. And the fact that he rang me to bring him through here.
Alright.
He did land alright, and then he sort of went. Because he realised he'd hurt himself.
So, whereabouts did it hurt you? Mostly.
Mostly it's there, and then there underneath. I cannot put my foot down at all.
Okay. Yeah, it's just the middle of his foot.
See, that feels weird.
You're alright.
Yeah.
Given Brad's history of injuries, Nurse Joe doesn't want to take any chances.
So we'll get an x-ray then, Bradley.
Thank
You
you.
know for X-ray, Joe.
Yeah, if you don't mind.
Yeah, no problem. Thanks, Joe.
Alright, see you in a minute.
Alright, love.
Will Brad's latest hijinks come at a high cost?
Please, whatever you do, don't touch my toes.
Casualty this afternoon,
There's pee all over there.
Sister Jane has had one of those shifts.
It's just a man who's come in who's just weed all over the floor. He's obviously intoxicated.
The red phone emergencies keep on arriving, and there's now just one bed available in Resus.
Real love, you alright? Which isn't good for me, is it?
Not in Resus, but in cubicle 4, Sean is dripping saline solution onto his face to cool down his chip hamburgers. Dr. Zafir Yazdani is going through the oil burns protocol.
It's important for me to know exactly what led to that event. We are talking about oil, so oil is going to stick to your skin. It will keep on burning your skin until you wash it properly with cold water.
Just a big bang, and it just obviously went into the face and my hand. So I spent about a minute of water onto myself.
The first thing that comes to your mind when he tells you it was basically a pan that caught fire is, did he inhale that smoke? Is his lungs at risk? Was there any smoke when all this happened? Any burns inside your mouth at all? Any oil that was going right there?
I don't think so, no.
No. There was no black smoke around or anything when all of this happened? No. So in terms of your breathing, you have been fine.
It looks like Sean might have had a lucky escape.
I see your hand here and I see the nose, so it's not like a deep burn that has happened, which is good. It's all about giving some creams to cool it out at the moment.
But as Dr. Yazdani is still in training...
And you had quite a chip hand, is that right?
Yeah, chip that one.
Consultant Dr. Jane Acton needs to do her own assessment to make sure nothing has been missed.
I'm just going to have a quick feel at the tip of your nose. Can you show me touching you there?
Yeah.
Initially, I'd never wanted to be a doctor. My father wanted my sister to be a doctor. For some reason, she's paranoid when she sees the blood, whereas I am not.
Okay, let's have a look at that cut on your hand. Are you burning?
And once I stepped into the medical school, that was the profession I wanted to be. I just loved it being there.
They're all small.
Very superficial.
Yeah.
Before the consultant is happy to discharge Sean,
And then it's just a matter of checking that his eyes are okay.
there's one final test she wants carried out.
We will wash it off after we have examined you properly, okay? Let's put your here. When you work in the emergency department, you see patients coming with complaints of head to toe. Something wrong with the head, eyes, nose, mouth, ears, neck, everything. So it's a nice, challenging environment. Good? You're all done? So there's no injury or harm to your cornea.
Superficial damage only, Sean can now head home. And Dr. Yazdani can tick another procedure off his training list.
Every day is different with my father's help. There we are. You're good to go home.
I have patched you up a few times, lad, haven't I?
Oh, yeah. Yeah, you have.
But there's certain things I can't patch up.
Such as this one here.
Yeah, exactly.
Nurse Lisa is spending her day off with family friend Brad in A&E.
He has literally done that move
Since
hundreds
about
of times before. Landed it perfectly every time. It should come with liability insurance.
Yeah. I bet it's not, bro. I already can sense it. Yeah, I sense it.
You need to get a can of man.
Nurse Joe has the results of his x-ray.
What's this little thing that you've got? Oh, you've got some little screws in there.
Yeah.
Can I take a picture of that little screw in my foot? Yeah. Because me and my mum were having a debate earlier whether I've got screws in my feet or not. And I told her I have.
Clearly you have, love, yeah.
What is it? Yeah. So, I can't see anything broken at all. So, I think you've got a soft tissue injury. So, you landed funny when you were doing your acrobatics, and I think it's just bruising and swelling. So, it will get better, but it can still take 6 weeks to get better.
Yeah.
Some crutches to help you get around. Good stuff. But, yeah, impressive backflip. Home in time now, tea, Bradley. Get paid.
Straight to pub now for me.
Absolutely not.
Having escaped serious injury this time, Brad's already planning what he can get up to next.
I could be a male pole dancer on this, you know.
Could be summer.
Good luck, Lisa. Thanks, mate. Nice to meet you, Brad.
Gonna need it, love.
I'm just going to do that for me. Thank you.
Thank you. Attention span of it.
Do you know what? You've hit nail on the head there.
Can you not just take up some of the safe, like, meeting? Sean will come back from her break next week.
Sister Jane's hard work in the hub is paying off, and the patients are starting to come.
Rob, your lady in cubicle 6, Frailty, have been to see her. They're happy for her to go upstairs if you are.
And it was it?
Yes.
Okay.
It's been a stressful shift, but it's also been rewarding.
What motivates me is that within me there is a caring, compassionate person who cares about people and what they go through and wants to do the best for them. So I think at the end of my shift is let me have a bath and go to bed and feel refreshed to come back and do it all again.
Next time on Casualty 24/7.
Doing really well.
Oh. No symptoms are quite concerning to me at the moment. He's been sick and he's not been going for a wee very much.
One of these electric garbles come down on my head.
It's popping glue in now, sweetheart.
Yeah.
I used to be 40. I'm now 21.
Everyone's mind, check out our 30 tips to cut your bills at 9 tomorrow. And tonight, it's a race against time to save lives in Royal Stoke Resus. Stay there for 999 critical condition next.